The City of Palm Coast, Florida, presented by Michelle Willard. These are the listed objectives for this presentation. Palm Coast was once called the Swamp Land until a corporate group took it over in 1969. There was a vision of marinas, golf courses, houses, and more. This area was once the largest infrastructure of roads, utilities, and sewer lines ever planned in Florida's history. In 1930, this corporate group called ITT purchased a ton of land, and a grand opening occurred in 1970. ITT maintained the community and made huge improvements using low cost to the state and taxpayers. Those improvements were an I-95 interchange, a bridge in 1988, and many beautiful canals. Flagler County residents wanted incorporation, and in 1999, the county finally became a city called Palm Coast. Palm Coast has been growing steadily since, and recently the U.S. Census Bureau designated Palm Coast as the fastest growing metropolitan area in the country with double the population. Today, there are over 86,000 people living in Palm Coast. There is a variety of adequate housing choices to meet the needs of this diverse population, including single and multifamily homes, apartments, condos, and duplexes. The average purchase price of a home in Palm Coast is approximately $223,000, which is about 15% lower than the surrounding areas, and the average monthly rent is approximately $1,400. This makes owning or renting a home in Palm Coast affordable and livable. There are also 2 low-income apartment and Section 8 housing. Educational opportunities for all age groups are available. Several public schools are A and B rated, and parents have the option of school choice, and this gives students in other communities the opportunity to participate in a school with quality education. The City of Palm Coast has 1 public library. According to the CDC, higher education and income levels are important to improve health in individuals and assist in rates of lowering chronic diseases. The city offers safety and protective services from the City of Palm Coast Fire Department, who provides EMS and fire rescue, and the Flagler County Sheriff's Office provides protective services to the community members. The Mayor of Palm Coast allocated $11,987,000 to the Public Safety Fund for 2018. According to Maslow's hierarchy of needs, safety and security is a basic need that must be fulfilled before psychological and self-fulfillment needs can be met. Local churches provide spiritual well-being to the community members by providing church services, local community outreach programs, and children's programs. Recreational activities are spread throughout the community. There is also a variety of community support services that can provide food, clothing, counseling, temporary cash assistance, and various other resources for those in need. Community support services are especially important because the median household income is approximately $49,000. Community support services can assist and help with families and vulnerable individuals in health promotion and disease prevention, management, social support, compassion, and effective health care. According to 2016 U.S. Census Bureau, 26.6% of the population is over the age of 65 years old, as compared to the county of 28.5%. The community also has a high rate of Black or African American of 12.3%, as compared to the Black or African Americans of 10.9% in the county. Health concerns include hypertension, heart disease, cancer, and an increased likelihood of needing long-term health care facilities. The CDC states that with decreased mortality rates comes an anticipated increase in the number of older persons that need public health assistance. This, along with an increase in chronic disease management, puts a strain on public health resources in this community. This community has a lower unemployment rate of 3.6% compared to 4.7% in the county, and a higher poverty rate of 24.9% as compared to the county of 25.9%. This community has a lower education rate. Various healthcare providers are available that accept Medicare, Medicaid, private insurance, and cash payments. Office hours are limited and do not include nights or weekends. The closest hospital is located on the southernmost side of the county. Healthcare disparities or community. The healthcare disparities may occur because of the difficulty in obtaining transportation to healthcare facilities. The Healthy People 2020 objectives. This objective The STD-1 is aimed to reduce the proportion of adolescents and young adults with chlamydia infections. The number of chlamydia cases has increased in the community. It is a common STD and can have complications if left untreated. A more thorough screening is needed to help reduce the risk of transmission and complications. The next objective is C11, to reduce the overall cancer death rate. The leading cause of death in Flagler County is cancer. There were 160 cancer deaths in Flagler County from 2015 to 2017. According to the CDC, between 2010 and 2020, cancer cases will go up about 24% in men and 21% in women. This objective, AH-6, is aimed to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care, dental care, or prescription meds. There is 4.5% of the community without health insurance. This writer observed many homeless people throughout the city of Palm Coast. Poor health is closely associated with homelessness. Families that may be struggling to pay rent, or a disability, or serious illness can turn into a downward spiral into homelessness. It can start with a loss of job, lack of savings, and eviction as well. This problem continues to rise. Homeless people may have multiple health problems. Being uninsured and homeless often lack access to most basic healthcare services. It is important for the city of Palm Coast to increase homeless healthcare services, including affordable housing and universal access to affordable, high quality, and comprehensive healthcare. When you drive throughout the Palm Coast, the city is kept up well due to the city's restrictions and code enforcement. There are many neighborhoods without sidewalks, and some neighborhoods have cars parked on the side of the road. Trash can receptacles are not provided by the city, and roads and neighborhoods have trash piled up on the side of the road as well. Waste services and recycling are provided by Waste Pro, and there's a curbside service for recycling. The community infrastructure enriches our neighborhoods and even one's home value. It is important to address the local government to get sidewalks, crosswalks, and street lighting. This is something that the city of Palm Coast needs, and community members need to safely walk on sidewalks instead of roads with barely any street lights. The Environmental Protection Agency has an air quality index of 24. That is good for this community. The EMS services are overseen by the Flagler County Fire and Rescue. The fire department gets all emergency medical calls, and the response time is 6.25 minutes, but the goal is under 5 minutes. There are many public officials that oversee Palm Coast. One of them is Mayor Melissa Holland. There are numerous community meetings for citizens to attend and can be done in a variety of ways for their convenience, such as a live stream and face-to-face meetings with dates and times posted on the City of Palm Coast website. All these representatives have direct phone numbers and emails listed. In one of the City of Palm Coast meetings, there were discussions about improvements at Palm Coast. Some topics included developing continuous street lighting plan for major roads and evaluate and attract special events that have a positive community and economic impact, and revisit the Parks and Recreation Master Plan and identify future amenities for inclusion in the capital improvement program. The 6 priority community problems are arranged in the following order based on Maslow's hierarchy of needs. Because Maslow's hierarchy establishes that food, water, warmth, rest, security, and safety are basic needs before one can progress to the other phases. Substance abuse is on the rise, and there are many businesses in this community that contribute to this problem. Liquor stores, convenience stores, bars, and restaurants provide unlimited advertisements in their storefronts and supply abundant alcoholic beverages to the community, residents, and visitors. This can promote other at-risk behaviors. In addition, drug abuse is an epidemic with over 22 million people in the U.S. requiring treatment for substance abuse. Resources must be implemented throughout this community for primary prevention, such as educational resources and promotion of abstinence and responsible drinking. It is important to use evidence-based interventions to effectively improve this epidemic in the U.S. and in this community. The uninsured in Palm Coast is a primary concern. There is minimal healthcare resources in Palm Coast. There are plenty of medical care facilities, but all accept insurance and cash pay up front before a service can be provided. And there are no free health clinics, so it appears that universal cultural competent care is lacking in this area by not having these services for the uninsured population in our community. Unprotected sex contributes to many sexually transmitted diseases such as chlamydia, gonorrhea, syphilis, and AIDS. All are identified as the 10 most communicable diseases in the county by the Florida Department of Health. Palm Coast contributes to these health disparities due to a persistent increase in STDs since 2015, 4.7% of chlamydia, 18.5% increase of gonorrhea, 17.6% increase of syphilis. Primary, secondary, and tertiary prevention strategies must be a main focus. The EMS response time and safety is a big concern in this community. There are long response times for medical response services from the Flagler County Fire and Rescue. The EMS services provided for Palm Coast are overseen by the Flagler County Fire Rescue. The fire department gets all emergency medical calls and receives many calls per day. The response time is 6.25 minutes, but the community and county goal is under 5 minutes. This must be improved to keep the community safe. For Maslow's hierarchy of needs, with safety being one of the components, this is a vital concern for the community. One of the leading causes of death, according to the Florida Department of Health, is cancer. Individuals that smoke are seen throughout the community. A secondhand smoke is inhaled by the community members. The City of Palm Coast does not have designated smoking areas throughout the community. Because smoking is considered the leading cause of avoidable death and leads to numerous diseases and disabilities, smoking cessation programs, education and community outreach programs, and awareness is drastically needed. The abuse of alcohol and illegal drug use is found throughout our nation and costs more than $232 billion annually in healthcare. Out of the 17 nations in the U.S. ranked the highest in the abuse of cocaine, cannabis, and tobacco. The community health nurse should intervene in this progressing epidemic by assisting in the promotion of healthy lifestyles, including increasing education, proper screenings, proper interventions, and prevention programs. Thank you for reviewing this presentation on Palm Coast, Florida.